single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. Governor Kathy Hochul and legislative leaders have made major progress on the state budget this week. As we discussed before, negotiations were stalled over proposed changes to the state's discovery laws. The governor wanted to change how and when prosecutors must turn over evidence in court cases. But the legislature argued there were other ways to address issues without weakening the system. On Tuesday, Assembly Speaker Carl Hastie told reporters that the controversial issue was now settled.
I've spent the last 4 out of 5 days myself and my counsel and our codes team actually sitting with the 5 DAs in the city. Of course, Mike McMahon is the president of the DAs Association. And I believe we worked through and we have a framework on having the discovery issue resolved.
This development represents a major push forward in negotiations, and we'll continue to bring you updates on the budget right here on the show. Turning now to our one-on-one interview with State Senator Jessica Ramos. We spoke with the senator about the state budget progress, as well as a bill that she's pushing that would stop the state from paying federal taxes in the event of cuts coming from Washington. Here's that conversation. Thank you so much for joining me here today, Senator.
Thanks for having me.
Of course. Now, you, along with Assemblymember Micah Lasher, proposed legislation known as the Recourse Act that would essentially allow the state to keep tax dollars it owes to the federal government in the event of potential cuts coming down from Washington. So can you tell us how this would actually work and why it was a legislative priority for you?
The Recourse Act compels the state comptroller to tabulate all of the federal funding that we receive so that if and when President Trump withholds funding illegally from New York State, we're able to withhold our taxes from the federal government in kind.
And if passed, how would something like this affect the ongoing final state budget negotiations and the agreement that the leaders will come to?
Well, right now, New York State depends on federal funding tremendously for infrastructure upgrades, for transit, for some of our education funding, and of course, SNAP benefits and other well-known federal services. But we want to make sure that we are able to deliver a continuous service to New Yorkers and don't want to see a lot of the federal cuts that have been threatened or have already begun to really impact our quality of life here. Just last week, Donald Trump and his administration announced a $300 million cut from FEMA for flood mitigation funding, a third of which would greatly impact our district. And so we're asking him to reverse course, because if not now in the state budget, we have to figure out how to make sure the work continues so that we're prepared for the next big storm.
And from your perspective, what is the appetite or level of support for this measure in the legislature right now?
Well, we've just introduced the bill, and we're quickly asking our colleagues to sign on as co-sponsors so that we can get it to the floor as soon as possible. We're hoping that Governor Hochul takes note and includes it in her budget, because it would be a tremendous tool in her arsenal when she has to negotiate with President Trump and communicate the needs of New Yorkers. We want her to be in the best possible bargaining position, and again, to make sure that we're protecting our most vulnerable population.
And what are the potential legal challenges that may arise because of this bill, and how are you hoping to mitigate those challenges?
Well, there are legal challenges with respect to many of the federal funding cuts that we've been seeing. And in acknowledging that Congress very often plays a role in the funding that has already been allocated, just like this funding, this flood mitigation funding that was championed by Congresswoman Grace Meng because of how hard hit our shared district was. And so we want to make sure that we are prepared for the worst case scenarios and understanding and really stepping into our power and our leverage as a donor state to this country so that we are respected and so that the work that needs to be done continues.
And you also sponsor a bill that would encourage employers to disclose increased information to potential employees about their compensation and benefits. So can you tell us more about that bill and, its support that it currently has right now?
Yeah, as chair of the Labor Committee, I am committed to making every workplace safe and every work interaction the most beneficial and best for our economy. And that, of course, means that workers should be empowered with as much information as they can to make the best possible employment decision that can lead to greater job satisfaction and a much more committed workforce for the employer. So I'm asking that employers disclose. We started out with a salary range on job postings so that people can have a realistic picture of what to expect during their job interview and what offer to expect. But now we're asking for a disclosure of the full package so that workers know just how well they're being compensated for the work they're being asked to perform.
And how would the Department of Labor ensure that these employers are actually complying with the law? And what would be the time frame that the employers would have to do this by?
Well, we're still getting the law passed, so it hasn't been signed into law quite yet. We are at the very early stages of being able to prioritize this bill and get it passed in the state legislature. I want to make sure that the Department of Labor is fully funded and staffed in order to do the level of work that it should be doing, considering how many employers are exploiting their workers and the wage theft that has transpired and continues to transpire in New York State. So we are hoping that the Department of Labor will be able to do this work along with the rest of the work they do to ensure safe workplaces.
And naturally, I wanted to ask you about the state budget. At the time that we're filming this, the state budget is several weeks late. So as Senate Labor Committee Chair, what are your thoughts on how negotiations are progressing this year? And what are some of the labor priorities that you're hoping make it into the final state budget?
The negotiations of the state budget have been a lot slower than any of us would like. There are some sticking points on policy that can certainly be figured out outside of the budget, if you ask me. There are very important needs that New Yorkers have right now in this era of affordability that need to be addressed immediately. And for example, temporary disability insurance reform is something that I have been championing in order to increase the short-term disability benefit for New Yorkers who haven't seen a raise since 1989 and have been paid $170 a week, which cannot be very helpful towards paying for rent and groceries and the like. So we want to make it easier for them to be able to get back on their feet and hopefully get back to work. The other priority of mine is baby bucks. It's an exciting initiative to help some of the less affluent women in New York State, helping break cycles of poverty with a small guaranteed income for women who are pregnant in their last 3 months and the first 18 months of a child's life. We believe that by helping mothers, we're making sure we're reducing the incidences of poverty among children in New York State, which will pay back in the dividends over the next several years and decades.
And just last week, Assembly Speaker Carl Hastie introduced legislation that would essentially allow lawmakers to get paid if the budget is delayed due to policy introduced by the executive chamber. So I just wanted to get your thoughts around this bill.
Well, you're speaking to a senator who proudly represents a working class community in Queens. I come from a working class family myself, and being able to pay our own bills would be nice. We all have a lot of concern around what's happening with the lack of affordability in our city and our state. And that's more the reason to make sure that we're passing the budget on time so that people can believe that their government is able to provide for them, and we can build the trust that has been lost in our public institutions.
And lastly, looking beyond the budget and toward the end of session, what would make for a successful legislative session for your conference and also for labor?
Well, certainly passing all my bills would be really helpful. Aside from the two that I've already mentioned, baby bucks and temporary disability insurance reform, and of course that Recourse Act, we carry a bill to do away with the requirement for minimum wage to qualify for childcare subsidies in New York State. It's very unfortunate that you have to make at least minimum wage in order to qualify for childcare. And that doesn't help those who are struggling to get by, who are waiting for that job interview and that opportunity to be able to provide for their families. We want to make sure there's a safe place for children, no matter the situation, at all times. I'm also pushing for a searchable database for veteran-owned businesses in order to help so many who are returning from service be able to get back on their feet and really make investments into our economy so that they can also have an easier time contracting with the state of New York for opportunities. I could be here forever talking about wage theft and all of the things that we need to do in order to make sure that every worker in New York State is going home with their full day's pay. There are still a lot of employers not paying overtime, asking people to perform work when they shouldn't, and lots of checks that are bouncing. And unfortunately, that doesn't mean anything to the worker that still needs to pay their bills. So making sure that we are keeping in mind that New Yorker who wants to stay in New York, who's been grinding every day, that should be the North Star in our state budget process this year.
Well, unfortunately, that's all the time we have for today, but thank you so much for taking the time to speak with us today, Senator.
Thank you. Good to see you.
And we were speaking with State Senator Jessica Ramos, chair of the Senate Labor Committee. Now turning to another important topic. For the last several months, the State Department of Health has been tasked with moving New Yorkers enrolled in the consumer-directed personal assistance program to one fiscal middleman, Public Partnerships LLC. Since then, the transition has been far from smooth. We sat down with State Senate Health Committee Chair Gustavo Rivera to discuss the challenges with that transition. Here's that interview.
Thank you so much for joining us today, Senator.
A pleasure to be with you.
So I know we have a lot to talk about. We'll jump right in. Can you start by telling me a little bit about what this consumer-directed personal assistance program is and why it's important to New Yorkers?
So the Consumer-Directed Personal Assistance Program, or CDPAP, as it's known, is a program that they started, I believe, back in 1995. The goal here is a Medicaid-funded program, and the goal here is to make sure that if you are a person that is disabled, elderly, but still are somewhat physically limited, but still have the ability to communicate, that you can actually choose the person who is your personal assistant, someone that helps you, get out of bed in the morning, feed yourself, get dressed, etc. All sorts of things that you do on activities of daily living, and it is funded by Medicaid. And you can actually choose a family member, so you can have someone who is your niece or your brother or whatever. There's all sorts of things. Now, so that is what the program is.
And what do you make of the transition so far? Why have you spoken out against this transition?
Well, this is a family show, so I would say it is a poop show from the beginning. I remember last year when the governor insisted that this be included in the final budget negotiations, and it was included in the final budget that we voted on. And I remember debating it on the floor of the Senate, telling my Republican and Democratic colleagues that yes, I was voting for it because it was included as part of the budget package, if you will, but that I didn't agree with it. I didn't agree with it then. I did not think it was a good idea. See, because to take two steps back, the issue is, it is true that the way the program is structured from the beginning made it so that certain folks might take advantage of it. The way that it works is that if you are, let's say that I am a consumer and I have a personal assistant, let's say you're my personal assistant, there is an entity called the Fiscal intermediary or FI that actually pays you. Because see, I'm not going to pay you from my pocket. I don't know anything about human resources, et cetera. So this FI or fiscal intermediary actually takes care of the paperwork, and the money flows through them to pay you. So the issue is that there were some companies, and it is true, that took advantage of the way the system was originally written, and they established a bunch of FIs that didn't particularly care about you as a worker or me as a consumer. And it is true that we needed to actually change that. I've never been pro the status quo on this issue. The problem is that what the governor did was force us to accept going from what are a couple of hundred fiscal intermediaries around the state to one single FI, and to do it in a very short period of time, in just a few months' time, with a program that is many, many times larger than the largest one across the country. So it was boneheaded. It was terribly managed, and unfortunately, we are seeing to this day all of the ways in which this incredibly mismanaged and mishandled process has meant that some workers are leaving. Some workers are leaving their consumers because they don't know if they're ever going to get paid. They haven't been able to make the transition, even though in good faith they've tried to do so.
And what do you make of some of the roadblocks that have tried to, delay or stop this transition? Most recently, there was a restraining order issued to prevent the state from forcing out home care agencies that acted as middlemen. I'm wondering, what kind of impact do you think roadblocks like this have had on this transition?
Fortunately, not enough. I mean, when we're talking about roadblocks, see, this is the thing. None of us believe that this transition was done right or that it was the right transition to make. There was a bill that I introduced last year. Now, we voted on the budget last year in end of March, beginning of April. And then after that, immediately I started working, and this was part of the budget deal, as I said earlier. Immediately I started working with colleagues as well as stakeholders to put a bill together to create what I thought was a reasonable alternative to the governor's insisted change. I introduced that bill in the middle of last year, and the reason I didn't introduce it immediately after the budget was because it took a couple of months to cook it right. It took a couple of months to work out all the kinks, and so we introduced what I think still is a reasonable alternative to what was forced by the governor. But that bill was not considered, and then since the beginning of the year, when the transition officially began, many of us have been consistently talking about this. We have been endlessly talking about it. I have talked about it publicly and privately over and over again, to the point that during the budget hearings a few months ago, speaking directly to the Medicaid director as well as the Commissioner of Health for the state of New York, I just asked them directly, do you have a plan B if this doesn't actually work? And the response was just, well, people just gotta start doing the process. And I said, well, I get that, but what if people actually start the process in good faith, tried to go through it? They were like, oh, there's people planting misinformation. So we were constantly, the roadblocks that we're talking about are people like myself. I will be very honest about this. Of course I wanted to roadblock this. And I wanted, because I had been consistently talking about the fact that this needed to be delayed. When a couple of months ago, when it became clear to me that these folks were just headed towards the cliff, they were driving a bus, the governor herself was driving a bus right towards the cliff without caring about what was going to happen on the other side of the cliff, I stopped talking about my bill as a reasonable alternative, and I started to talk about a delay. Because I thought that if you are insistent on this one FI business, which I thought was a bad idea then, and I think is a bad idea now, at the very least, you could delay the process so that the people who in good faith want to make the transition and make sure that they continue to receive services and they continue as workers to be able to get paid for their work, that it didn't fall off a cliff. But it fell on deaf ears. And the governor and the Commissioner of Health proceeded to drive that bus off a cliff. And the bus is careening down the side of the mountain as we speak.
And what did you make of this? So you talked a little bit about the delay. The Department of Health delayed it they gave a quote grace period.
Not a delay. Wasn't a delay. It was they called it a grace period. But see, this is the problem. They said, oh, well, you know what? By the way, when they did that, a couple of days before the April 1st deadline, it was an acknowledgement that they couldn't get it right. That was the first thing. But instead of trying to get it right and doing what we all had asked them, which is just to do a delay, which the governor could do by an administrative action, instead, what they did, they said we have a grace period. there was a lawsuit that was brought, and then a judge issued a temporary restraining order, and the administration interpreted it by saying, if you, let's go back to this, right? I'm the consumer, you are the personal assistant. It was interpreted, the temporary restraining order on its face would say, hey, state, after April 1st, the statute says that only PPL, which is this company, we haven't even talked about this terrible company, but okay, PPL, which is the single fiscal intermediary that has been allowed to work, right? They're the only ones that can pay any worker after April 1st. A delay would be to say, could we make sure that until people make the actual transition to PPL as workers and as consumers, that whatever fiscal intermediary is still providing for their paperwork, maintaining time, etc., could we make sure that they can continue to do that legally? Well, they didn't issue a delay, so that happened on April 1st. And then that meant that the temporary restraining order, which was issued by the judge on its face, would say, well, you can have that fiscal intermediary, that third one, not PPL, the other one, whatever it is, ABC Health, right? ABC Home Care. ABC Home Care is your company, that the fiscal intermediary, but now it's April 2nd. Because of the temporary restraining order on its face, you should be able to continue while you're doing the paperwork to get transferred over to PPL to be paid by this one. However, the state said, if you had any contact with PPL, you are deemed to be complete. You are deemed as a worker, and me as a consumer, to have already made the transition. Therefore, legally, ABC Home Care can't keep your time, can't issue payments, can't do anything, even though the temporary restraining order on its face says that that should be the case. So the state completely bungled that up too. So they didn't even issue an actual delay. They called it whatever they called it, a grace period. But it doesn't actually solve anything, because this is, another piece is that the transition, the interactions with PPL were a complete mess. The website didn't work. They couldn't get anybody on the phone. The offices physically weren't and didn't have anybody in them. And this is while the Commissioner of Health lied. And I will say that very clearly. The Commissioner of Health lied about what was available to people who were trying to make the transition. Said, go to the offices. Offices didn't have anybody to staff them. Call the number. People never got a call back. They speak your language. People actually never could get somebody who spoke their actual language. Just access the website. Oh, the website just says error, error, error every time you try to access it. One time after another. So this is what happened to people who, again, in good faith, were trying to make the transition. What the governor seems to say is that there are some people who are bad actors who have spent millions of dollars trying to misinform the public and workers and consumers. Those people do exist. Those people, those bad actors who have been benefiting from the current system, that does exist. But I don't care about those people. I care about the folks who come to this office and who call this office and who call my office in the Bronx, telling me about the challenges that they've had to actually make the transition work for them and their consumers. Those are the people that I care about, and those are the people that apparently this administration does not care about, because they stopped listening to them months ago.
The health insurance options for workers and patients on the new singular fiscal intermediary public partnerships LLC is either limited, and so there was a report recently by the Fiscal Policy Institute that had said that the options don't cover basic services, and how it's going to essentially leave some workers potentially without insurance. What did you make of the findings from this report, and what's happening with these options?
The findings of the report were just describing the reality of the situation. This was not an investigation as much as it was just like, hey, so what's that health coverage that you as a worker would have access to? The same way that you or I, and whatever insurance that we have, and ultimately we will have the New York Health Act, which means we won't need the insurance product, but regardless, right now, if you have an insurance product, whatever it is, you can get information about, okay, so what does it actually cover, right? You can get that information from the health insurance company. So that's what this investigation did. It just asked, show me what the benefits are. And when you see the things that are covered, basically there's one or two things that are covered. The point is that you had one thing after another, after another, after another that were not covered. Things that would be in a basic health plan should be available to you, should be accessible to you, and they're not. And this is for the workers who have been forced to take this plan on, who might actually have a better plan available to them if they hadn't actually made the transition over to PPL. It's a mess, the entire thing from the top to the bottom.
Well, thank you so much for taking the time to speak with us, Senator. Unfortunately, that's all the time we have. I want to thank you again for sitting down and chatting with us.
You're quite welcome. I'm sorry for the soliloquies.
And we're speaking with State Senator Gustavo Rivera.
Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,